get maximum time of the speaker, no?
Correct.
So, good evening, friends. I'm Dr. Sneha Majmudar, President of HMAI Ahmedabad Unit. Welcome all of you. Here, I especially welcome all my respected doctors, Dr. Piyush Bhai, Dr. Keur Bhai, Dr. Bhaskar Bhai, Dr. Sunil Bhai, and all other respected doctors too. Today, we have gathered to learn about the acute prescription from an eminent speaker, Dr. Subhas Singh sir. He is a highly learned homeopath at national level, and to introduce him, I would like to invite Dr. Keur Majmundar. Dr. Keurbhai Majmundar is immediate past president of Gujarat State Branch. He is a National Executive Committee member from HMAI, Gujarat. He is also a Secretary of Constitution Committee at central level. So now I request Dr. Keur Majmundar to introduce Dr. Subhas Singh sir. And before that, before he speaks, I would just let all know that the question answer session will be held after the completion of the webinar, so that you can till that you can write down in your chat box, and after that we will handle that question answer session. Thank you very much, and over to Keur Bhai, Dr. Keur Bhai.
Thank you, Dr. Sneha. It's my really privilege to introduce my friend, Dr. Subhas Singh. I know him since quite a good number of years, and we meet very regularly through HMAI platform in our various meetings. And I'm really happy to welcome him in this webinar through this virtual video sessions in Ahmedabad. Sir, I welcome you on behalf of Ahmedabad Unit in this our continuous medical education program. And I'll divide introduction of Subhas Singh into three different categories: as a Hamayan, as an academician, and as a practitioner. Being on the HMAI platform, I will introduce him as a Hamayan. He is a chairman of Scientific Standing Committee of HMAI, which is a very important committee of scientific activity of our HMAI. And another important aspect, we all must know that he is a director of a very prestigious homeopathic institute called NIH, National Institute of Homeopathy, which is a very premium homeopathic institute at par as AIMS in modern medicine. And he's director and heading this NIH. He is also PhD in homeopathy. He is also guide, and various students have been benefited under his guideship to complete their dissertation and acquire the PhD. He is editor of National Homeo Recorder magazine. He has written many books, and above all, he is a great prescriber. He is having very sound knowledge of clinical materia medica. And to introduce further, he is the son of a great teacher, Dr. Mahendra Singh. Dr. Mahendra Singh was a great homeopath. He was our ex-HMI president, and he has inherited the values of homeopathy and qualities of homeopathic prescriptions from Dr. Mahendra Singh. And today we are definitely going to learn a great, because he is having very fine insight about the homeopathic materia medica, and we are going to have a great session today. So Dr. Subhas Singh, without wasting much time, I would hand over this session and platform to you so that we can have a maximum learning from you. Over to Dr. Subhas Singh.
Yeah, is the slide visible?
Yes.
Okay, thank you very much. I have seen Dr. Bhaskar Bhai is here. So, Dr. Bhatt, Dr. Keur, and Dr. Joshi, and others associated with HMAI, my regards to everybody for giving me this opportunity and continuing with the various academic activities of HMAI. HMAI Ahmedabad is a very active unit, we all know, and I am lucky and fortunate to be today being a part of it. The topic that we are going to discuss today is acute diseases. So what we are here discussing is what is acute disease and what homeopathic books, homeopathic literature says about acute diseases and how we are going to tackle acute diseases and with help of what. I'm sure you all have heard of Goswami Tulsidas, the author of Ramayana. He has said a line, and I firmly believe in it. He says that Sakal Padarat Yahi Jag Mahi, Karam Heen Nar Pavat Nahi. Sakal Padarat, everything is in this world only. And faithless person, Karmaheen, those who do not work for it, they do not get what is in this world. My intention of quoting here is this, to tell you that whatever I am saying or going to say, or the slide that you are going to see, none of these are new. All has already existed, all is already there, told by Hahnemann or by somebody else. I am just being a media to share this with you. And especially, I have taken from the stalwart because I firmly believe that practice is not something which is separate from the organon, which is not something which is separate from our guidelines, literature, and what Master has said. I find many places, yesterday also I had an experience, many places people saying that this is what is different from the guidelines, what is said, because practice is totally different from theory. We have to understand that practice and theory is not different. What we say theory is basically the principle, the guideline, the rules, and that is the master, and in Kant's language, practice is the slave. So it is supposed to guide it in which way the practice should go. The moment practice becomes independent of the rules and guidelines, there will be anarchy. So let us see what our master has to say, and other stalwarts, of course, has to say about acute diseases. We all remember aphorism 3, where the knowledge of the physicians are enlisted. And there one particular part to which I want to draw your attention is that before coming to how, it is important that what a physician should treat, what we are supposed to treat. When a patient comes, I have to identify, okay, this is the part which I need to treat, and that has to be identified. That is the knowledge of disease. And when you get the knowledge of disease, you have to identify the indication. So later on we will come to indication. Now the knowledge of disease has to be known, because knowledge of disease tells you what has to be cured. So knowledge of disease means not only the diagnosis of the disease, means this is the disease, say this is malaria, this is typhoid, this is cancer. Not only that part, but more importantly than that is the homeopathic classification. We have our own classification. Master was frustrated with the then system, and then he advocated a new system of classification, and we have to have our own. Accordingly, we have to have a diagnosis. We have to diagnose that, okay, according to homeopathic classification, this is a disease of acute or chronic, or further classifications are there. So once you classify this is an acute disease, your whole approach, your whole the way you are going to see and treat the case will be different from other case which may be chronic. So it is very important that we should know what is to be cured in a patient. We should know what is the knowledge of disease, and from that we have to base our whole approach to the case. We all know what is acute disease. We all know, according to Organon, acute disease is something which has certain criteria. It has a rapid process, it has a short life, it ends in death or recovery, and it should have a exciting. That is what Master has said in aphorism 72. So these are the criteria that has to be identified. And then only you can say that this is an acute disease. We all are more or less in this way or that way having Sora in ourselves. This can be a subject of long debate. Somebody can say that I am free of Sora, or somebody can say that I have all the three Maja. But one factor, let us take generally speaking, that we are Soric. And acute disease has also been defined as the transient explosion, the temporary explosion. So this Sora, the Subhas Singh that you are looking at, is a Soric person. Apparently he is healthy. If you take my symptoms, you cannot get any symptom of the disease. And then this transient explosion can be there because of any triggering factor, which in homeopathic parlance we call it as exciting factor, exciting cause. So it has also been defined as a transient explosion of the latent Sora. Hahnemann and later on Kent and others, they all believe, and we also who treat, who see patients, we believe that comparatively acute disease, in order to identify them, in order to treat them, it is much easier if we have to compare with chronic disease. But then the question comes, why most of us, exceptions can be there, I'm not talking of them, but most of us all over India, maybe all over the world, whenever some severe acute conditions comes, we refer those cases. We try to avoid those cases. Wherever, if we go in our old literature, then we find that even in the most severest condition has been treated by homeopathic. So these acute conditions, these life-endangering situations are usually referred by us. And I'm not saying this is right or this is wrong, because there cannot be one simple answer. There are so many factors which is coming out as this, that we are referring such cases. But one thing is, we have to realize that homeopathy came out of the failure of allopathy, the failure of then prevailing system of medicine. And failure in what? To treat such acute, severe, life-endangering situation, be it the scarlet fever epidemic, be it the cholera epidemic. These were the conditions in which the other system were failing, and then the homeopathy became the substitute and a successful substitute. So this has to be kept in mind. Let us see, just to recollect, what are the types of acute diseases. We all know: individual, sporadic, and epidemic. As the name suggests only, that individual will attack one person at a time, and when it will attack one person at a time, the factor which is causing it, the causative factor, will be such which will affect one person at a time. So when we are diagnosing a case that this is acute disease, then the next step comes to diagnose it, whether it is acute disease of individual type, sporadic, or epidemic, and accordingly search for the causative factor. The exciting cause, as you can see in the slide: excess of food or insufficient food, severe physical impression, chill, overheating, dissipation, strains. These can be which can affect one person at a time. These do not affect large person at a time. Whereas in case of sporadic, a small group of people of one area, by means of meteoric and periodic, and the susceptibility. Here the role is susceptibility has to be there. And susceptibility is common, which is bounding these 3, 4, 5 persons who are affected by sporadic disease. And whereas in case of epidemic, as we can see that we all are now affected by the epidemic, a pandemic in fact, here the large number of people are affected. The causation has to be such which will affect those large number of people. And that can be such which can affect a large geographical area and a large population. The calamities of war, the inundation, the famine, the flood or the famine. These are the causes which will affect a large number of people. So from there we get epidemic, acute disease. Now let us see how the acute diseases develop. As we all know that there is a gap between the moment I am affected and the moment I am manifesting the symptoms. There is a gap between these two. And this is the gap when I am symptomless. I don't get any symptoms. So the affection which affects, the dynamic factor which affects, then slowly it involves the whole person, and then it manifests through 1 or 2 symptoms depending upon the person who is affected and the factor, the causation which is affected. This is how the acute diseases develop. Now, as we have just discussed, what are the causes of acute disease? Let us just recollect. Like in acute disease, individual, we get excess of deprivation, violent physical impression, chill, excess heat, etc. But other factors also can be responsible for causing. For example, in aphorism 17, Master is talking about power of imagination also playing a role in causing a disease. We all know the story, a very old story we may have heard in childhood, that there was a king and his Mantri Sabha, especially the Prime Minister, Mukhya Mantri, Pradhan Mantri, he wanted to kill the king, harm him. So he, in connivance with others, he brought a Sadhu Maharaj, and that Sadhu Maharaj, after reading the palm and other things, he said that this Raja is going to die on the such full moon day. And after that, the Raja became sick, and he was not doing any official work, nothing doing, and he was already on the verge of. And the queen, who came to know this, she knew that all this is false. So she brought another false Sadhu Maharaj, and with much more pomp and show, that Sadhu Maharaj ultimately proved to Raja that the earlier one who has come was his student, and he said, no, you are going to live 100 years. So he became healthy. So this power of imagination, that also causes acute disease. The results can be, examples can be innumerable. All of us in our personal life have been some time or other affected by some mental problem which has resulted in some physical ailments or even in mental ailment. The most common is not able to sleep properly. During this corona time, almost all of us, there are many factors which is common. If you take a common disease, then there are many things which will common in all of us. And maybe sleeplessness, irritability, loss of temper, insecurity, fear, all these things are which is common. Even in those persons who are not affected. So what is the this fear of this fear that I will be affected? In acute condition, before I elaborate, let me give you one example, a very common example which we can all connect. A patient came to me. This is not a real patient, huh? This is a story. Imagine a patient comes to me. He's around 5 years old, fatty, flabby. When I came to know, all his milestones are delayed. He catches cold very easily. Get tonsillitis affected. He don't want to work, is very lethargic and mentally also dull. And he has sweat all over the body, especially on head, which is very sour smelling. And he came to me with an injury in his head. Injury because somebody, his brother or somebody, hit him with a danda, a stick, and there is a red swelling turning towards bluish, which is very sensitive, no blood still, but it is very sensitive, and he is crying in pain. Now, this person is giving me signs and symptoms of Bulgaria. And this person has come to me with the manifestation which require arnica. So what should I do? I should give him Pilgriya or I should give him arnica montana. Those of us who are thinking that calcarea carb is the right medicine, for them my simple advice is that they should revisit their homeopathic studies. And if we all agree that this moment arnica is the medicine, then there is no problem, we are all on the same page. So as I was saying, that when a person, now this boy only, Kolkata boy, forget that he has an injury, think that he came with 104 fever, with face totally flushed, tonsillitis, and this 104 fever is after yesterday he had a haircut. After that, this boy now has 104 fever, full throbbing pulse, carotid, everything. So still he is indicating calcarea carb, but this stage requires belladonna. And he tells me that every time I had a haircut, the parent tells me that every time the boy has a haircut, he will have fever. Every time he takes an ice cream, he will have fever. So in acute disease, when we are searching for a constitutional medicine, when we are searching for a patient's anti-miasmatic medicine, at that time, the history of acute diseases have no value except to indicate the tendency of the patient. So when I get this person and he doesn't have a fever now, then this recurrent fever after having haircut or ice cream, that indicates the tendency of this person, tendency to have cold, tendency to have fever, tendency to have tonsillitis, and which further confirms whatever medicine I am supposed to. Acute diseases superimposed on chronic disease. The example I gave, that this chronic person, this boy, calcarea carb person, calcarea carb boy, now when he came to me, forget arnica, suppose he came to me with fever. So when he came to me, he has this belladonna superimposed on calcarea carb. And at that phase, if I give calcarea carb, the calcarea carb is not going to tackle the fever, it is not going to tackle the tonsillitis, it is not going to tackle the acute condition. So required in that condition is to give belladonna. And what will this belladonna do? Belladonna will cure him permanently? No. Belladonna will bring back this acute explosion, a transient explosion of latent sora again to that latent phase. And when there is no fever, no tonsillitis, then the person will give me all the signs and symptoms of calcarea. So at that time, what is required is to give calcarea. So it is very important, as it is in slide, it is very important to avoid getting confused by two disease images that may exist in the body at the same time. A chronic patient, for instance, may be suffering from an acute disease, and a physician on being called, they may think that it is necessary to take totality of the symptoms. Totality of the symptoms, before totality of the symptoms, it is important that you should diagnose. Why in the beginning I only said that you have to diagnose the case, homeopathic diagnosis. You have to diagnose this is an acute disease or a chronic disease. If you diagnose this is an acute disease, then you will go for acute totality, where you will not consider his sour swell, where you will not consider his delayed milestone. But if your diagnosis is this is a case of a chronic disease, and then you will not consider if any symptoms remain of the acute condition. So, but if it should do that in an acute disease, mixing both chronic and acute together, he will become confused and he will never be able to find the right medicine. Mostly, in acute condition, the manifestation of chronic disease, except for the constitutional feature, the generalities, they recede. Let us continue with this example of calcarea carb and belladonna. So this boy, when he comes to me in acute phase, he will remain physically a calcarea carb. He may have the same desires and generalities of calcarea carb. But then when I am considering the acute fever, I will definitely not take into consideration these factors. I have to take into consideration only the acute symptoms. That is why the acute totality. The awakening of the internal sora, which has hitherto slumbered and been latent, that after giving the medicine, it should brought back to be again the latent phase. And it, as it were, kept bound by a good bodily constitution and favorable external circumstances, as well as its breakout into more serious ailment and malady, is announced by increase of number of symptoms. When the person is in latent phase, and then when he is getting activated, and there is more number of symptoms, which are because of this slumbering sora, the latent phase of the sora has arisen, and also by numberless multitudes of various other signs. So never prescribe for any two conditions. Acute and chronic disease, they do not complicate each other. They will never complicate each other. They have their own total separate identity. One cannot get confused between the acute phase and chronic phase. The acute is never complicated with the chronic. The acute suppresses the chronic. If we remember our organon properly, then when two dissimilar diseases meet together, the stronger one suppresses the weaker one. In acute, because of its virulence, is more strong and it suppresses the chronic disease till it has completed its action. Of course, the allopath will tell about the sequelae of measles and other fevers. Now here, see, this is the wonder of homeopathy and homeopathic literature. See, time has changed. We need not criticize allopathy, the modern medicine, because now time has come and it is the demand of the time that both should coexist and complement each other rather than criticizing. But some of the old concepts still exist, maybe in a modified or different language. For example, if whatever we are saying that acute diseases are separate, chronic diseases are different, and they do not complicate each other, then how can we justify or give explanation for sequelae of the disease or complication arising out of acute disease? See, this looks like something very complicated, but the answer is very simple. In words of Kent, when a person is sick from acute disease, after the acute disease is over, his sickness is over, but his weakness continues, he's convalescing, and during this phase, the sequelae, regardless of the disease, which steers them up and are soaring and prop out at the weakest time. Which is the weakest time? The convalescent. And the better the acute disease is treated, if it is treated with good homeopathic medicine, with proper dose, repetition, everything, so there will be less of weakness, and that is why there will be less of sequelae, less of complication of acute disease. Not I am saying, this is what Kent has said. Another wonderful example. Suppose a person in aphorism 221, Hahnemann is talking about that when a person is suddenly having fright or fear or something like that, and after that the person totally become maniac, as we call them, pagal ho gaya hai, and he starts behaving like that. It can be certain fright, certain rage, certain anger, certain insult. It can be anything on a mental plane. And after that, the person is totally behaving abnormally, from which he is not getting well. What should we do? If we have to treat, this is an acute phase of a chronic disease, which was in latent phase. And this latent phase has suddenly arisen because there has been a triggering factor, the exciting cause, which has given rise to this sudden manifestation of insanity-like symptoms. So if I select a medicine based on my totality of the acute condition, will it treat? See, the guidelines are very, very clear. It will remove the acute condition. And this acute condition can only be removed but not permanently cured if there is some miasm involved. And if there is some miasm involved, then this is the time, after the acute phase is over, then this is the time where the medicine, some anti-miasmatic medicine has to be given. We all know case taking in acute disease is comparatively easier because it is of shorter duration and it takes less time. Comparatively, patient is very clear in his manifestation. But the problem comes about finding out what is the exciting cause. And we cannot exactly pinpoint this is the exciting cause. And because we cannot pinpoint, practically it is not possible to pinpoint. That is why Hahnemann has said in aphorism 5 that what you have to do is you have to find the most probable exciting cause, because exact exciting cause is not possible. So most probable exciting cause. And then still if we say that the practice is different and what is written in organ and indifferent, I don't think there can be a more bigger fool than us. And why is he said? Because anything, one person's poison is another person's food. There are people who live in -degree temperature. And then there are people who go to slightest cold and then they start having cold and cough. So this person is able to tolerate it, but for the other person, the cold and cough is excited by this slightest of cold and cough, slightest of cold temperature. For him, it is normal. For him, it is So anything going in sun, there are farmers, there are persons who work in sun, day in and day out. Even in rainy season, even in the hottest of the sun, they have to work and they are working, nothing happens to them. But there are persons who will go in sun for 5 minutes and they will have severe headache. So for them, the headache is for that type of headache, the sun is exciting. But for others, it is not. So it was not possible to exactly find out. That is why Hahnemann has said that the most probable exciting. No real cure can take place without a strict particular treatment of each case of the disease. In acute disease, the chief symptoms strike us and become evident of the senses more quickly. Of course, a person was living a normal life and the next day he has fever, he is not able to go to school or college or duty, office. So this change has been brought up by a condition, so he will be very able to clearly give you the signs and symptoms of acute condition. Tracing the picture of the disease, and much fewer questions are required to be asked. It is easier because there is a shorter duration. There is another thing which is indisposition. And we have to, a physician have to is required to differentiate between acute disease and indisposition. See, there are many conditions which has been described in Organon of Medicine, where Hahnemann himself has advised that no medicine is required in this case. Indisposition is one of them. You have to identify that this is a case where just management, non-medicinal management, with proper diet and regimen is enough to bring back the person to the normal. And this is a condition where it is required that you should give a medicine. Ek aadmi, he has gone to some late night party, had a drink, rich food, and then came late, could not sleep properly, and he is having next day feverish, not fever, feverish, malaise all over the body, bowel movement disturbed, ache all over the body. But these symptoms are not developed to such an extent that you get the location, that you get the location, the position, the modality. All these are not so prominent that you get it. So this is a case where just the non-medicinal management is enough to bring back the person to the normal. And this what Hahnemann in 149 has called as indisposition. Now, how to take up the case in these cases? In acute totality. How to find the medicine? You will see in Organon or in any of his writing, Hahnemann has not given us any format for case taking. Many of us in our clinic use formats. In teaching, we give formats to our students. But Hahnemann has not given any format. He has said that it is important that you should do the case taking and get all the symptoms that is possible. What is the purpose of case taking? Individualization. So that purpose should be clear in your mind. You should get all the symptoms that is possible. But he has not given any format. Later on, many of his followers have given some ideas, some help, some clues to make the whole thing much easier. Hermogenes, a very first century Greek philosopher, he gave a certain point, and that was for a different purpose. But from there, Bonninghausen, he took those points and he says that these are the points by which you can ask a question. You will see all these things will appear known to you. Hermogenes said, quis quid quando ubi cur, quen ad modum and quibus ad miniculis. And the last two, Bonninghausen replaced with quomodo and quibus auxiliis. So in case of acute disease, if you see, just look at these points and just try to assess that can we complete the case taking with the help of these? Who, what, when, where, why? Quomodo means how, and quibus auxiliis means along with what? Auxiliary, concomitant. These are the points by which we can make the case taking much easier. Not so much in case of chronic disease, but very helpful in acute conditions. In epidemic diseases, the case taking, we all know, Hahnemann has been very specific, and he said that in order, because the epidemic diseases are a type of acute diseases, so severity is same, it will end in death in recovery, will have a short time. So in order to save the life of a person, he said that we don't need to individualize each and every case. We don't need to individualize each and every case. What we have to do is we have to get the complete picture of not of the individual but of the disease. For that, we need to take case take of the number of person as is required to get the complete picture of the disease, not of the patient. So once the complete picture of the disease is there, then on the basis of that, we select a medicine. That medicine will be curative as well as preventive. And later on, that name, the name of the medicine was known as genus epidemic. In case of acute diseases, dosing. The basic principle is that we cannot say that what dose will be required in which case. So all potencies are required for cure of diseases, and any potency may be required for any given case. But there are broad guidelines. The guideline is that our medicines do not act on the person because of their content, their physical content, material content, but they act because of their dynamicity, and that is why they act on the dynamic plane. That is why they affect the vital force. So more the tendency to be affected, more the sensitivity of the person, more dynamic will be the medicine. So Hahnemann in Materia Medica Pura has said for delicate persons and in acute diseases, higher degree of dilutions are to be expected. That for acute condition, higher degree of dilutions are required. Higher the susceptibility, higher the potency required. Usually susceptibility remains high in case of acute disease, so high potency is required. After the medicine has been given, there will be slight aggravation, and that aggravation is many a time immediate in case of acute disease, and we welcome that aggravation because by that aggravation we come to know that the medicine is perfect, and if the dose and the quantity of the medicine is good, then there will be aggravation, but that aggravation will be just less, just enough to let us know that the medicine is perfect. That aggravation is known as homeopathic aggravation. So smaller the dose, so much light and shorter is the apparent increase of disease during first hour, the homeopathic aggravation. Repetition. The basic rule is same. Our medicines are supposed to help the person to overcome the disease. Medicine do not cure. Medicine help in the process of cure. So once it is, if it is so once the process of cure has started, you don't need to give the medicine. You need to give the medicine only to initiate this process of cure. And how you will know what is the process, when the process of cure has initiated? Once you get the manifestation, as in early. Once you get the aggravation, that means your medicine has acted. And then any other repetition will only further harm the patient. There you need to wait and let the medicine be exhausted. But this part I know it is easier said than done. Because you see, in case of acute diseases, we feel like repeating as soon as possible, as quickly and at shorter intervals so that the patient gets well as soon as possible. But your later doses, after the first dose which has acted, you can repeat till the first movement has started. The first change has started. But once the change has started, then any other dose after that will have two effects. One, it will not produce any change. It will act like a placebo. Or second, it will harm. And we don't want either of it. So my advice is to avoid repetitions once the process has started. What if the wrong application, which very often happens in case of acute disease? And we can know that the medicine has not acted. If you give the medicine very strongly, there are innumerable examples in everybody's clinic. If the medicine is not given properly, but the doses are less, so medicine acts like placebo. Patient comes and tell you, Doctor Sahab, kya dawa diye? Nothing has happened. I have taken your medicine, but jaisa tha waisa hi hai. Or, Doctor Sahab, I came to you with this complaint and now this new complaint has. So your medicine has acted unfavorably. And when it has acted unfavorably, what is required is to antidote them. And this has to stop. The effect of the medicine should be stopped. You cannot allow the medicine to exhaust its action in such condition. You have to give a medicine, a counter medicine, antidote, which will stop the further action of this medicine and not the correct medicine. Cases where the patient, however, excessively seldom in chronic, but very frequently in acute, feels very ill, although these symptoms are very indistinct. Diet and regimen, rules are very simple. In acute condition, Hahnemann's justification was that when the person is in acute condition, since it is only of a shorter duration, not of much longer duration, so the nature, whatever is required for the patient, the nature will ask for it and let the patient have it. He said, let the patient have it. Apparently, sometimes, even if those appear to be temporarily harmful, let him have it. Because he is saying in Hahnemann's word, that one side, if you compare the harm that is taken by that thing, and another side, the happiness or satisfaction that he is having, because whatever he wants, he is having that, then satisfaction and happiness is more beneficial. So he says, let him have whatever he requires. Place no obstacle in way of this voice of nature by denying the urgent desire of the patient. Just be careful, he doesn't ask for totally harmful anything. When acute condition subsides, what we are supposed to, we have discussed it, we have seen it so many places, that acute disease is not a complete disease in itself. If you remove the acute disease, the person is not going to be cured. Like the example in calcarea carb and belladonna, when the belladonna symptoms are gone, the tendency remains. The calcarea carb patient remains. So when the acute disease is gone, in order that the person is permanently cured, you have to find the anti-miasmatic medicine which is suitable for this person. That has to be. Now, the medicine that we have to select. For this, these are the 3 points that should be kept in mind. One, totality of symptom is not portrait of disease. If we see our organon, then aphorism 6 is all the conceivable signs and symptoms together, they are called the portrait of disease. So conceivable signs and symptoms, whether those symptoms are important or not important, common symptoms, particular symptoms, general symptoms, anything together, that can contain morbid phenomena, that can contain accident, that can contain symptoms. Together they will form the portrait. And from that portrait, if you take the essence of the disease, outwardly reflected picture of the disease, essence of the disease, that will be your totality. Not the disease in its whole extent, but the essence of the disease. So when the person is suffering from an acute phase, then you have to take a totality which will not be the whole disease, but will represent the essence of that acute phase. Whereas in case of chronic disease, you have to take the totality in such a way that will represent the essence of that chronic disease. These two things need to be differentiated and be very clear in our mind. So, in acute totality, we have to take into consideration